Hello and welcome to the Eating Disorder Therapist podcast. I'm Harriet Frew, eating disorder therapist, here to support you in overcoming disordered eating and finding peace with food. So thank you so much for listening today. Now today I'm going to talk about themes I am seeing every day in the eating disorder therapy room, because there are some common things that come up again and again, and I'm sure if you're listening you may relate. So let's dive in. So when you're struggling with an eating disorder, you really feel very alone. You feel abnormal, you often feel really out of control, and you feel so lost in your preoccupation with food. And you often think everyone else can just eat normally. Like, what is wrong with me? You believe there's something distinctly wrong with you, and maybe you consider that you're flawed or greedy. Now, this could not be further from the truth. So in this podcast, I'm going to explore some of the themes that are emerging again and again inside the therapy room. So hopefully you'll relate to some of these themes and feel less alone. Okay, number one, being stuck in your head. Now, information, it's available, isn't it, 24/7 and in incredible abundance. So ChatGPT or Google or a combination of both can dispense useful advice within seconds. So I find these days that clients come into therapy knowing volumes about what is supposedly helpful. And you may relate to this. Perhaps you've listened to the podcast, you've read the books, you've followed numerous accounts on socials, and you could probably write a well-informed article for a good friend detailing proactive recovery steps. Now, information and education are wonderfully helpful, but healing is not all about the thinking brain. Healing requires a connection with the body and feeling emotions too. It involves connecting with your inner voice and knowing. It involves getting back into the body and being rather than constantly doing. Now, this requires a calmer nervous system. It means slowing down and pausing and learning to connect with the self. And no amount of knowledge can substitute for this, although knowledge may start the journey and guide you along a helpful path. So if you relate to this, the next time you feel a compulsive need to seek information or reassurance, pause, take a breath, and consider that the solutions are not necessarily outside of you. So maybe go for a short nature walk without stimulation, or journal your random thoughts, or maybe even lay on your bed and rest for 10 minutes. Just notice your thoughts that come to the surface, being mindful and non-judgmental of them. And you will find that adding more stillness will bring unmeasurable benefits. And in time, you will start to trust more in your own knowing and intuition. And this is a really, really gradual process, because I think often we are spinning so fast on the hamster wheel of life, and we're in like really, really high anxiety. We're so in our heads, we're not in the body at all, and we're so disconnected and we don't even realize it. But so much about healing is coming out of your head and getting back into the body. And you don't have to reject all the knowledge and information and valuable stuff. Like, your thinking brain is incredibly helpful for you, but you want to balance that as well with your feelings and being more connected with yourself. So that's number one, being stuck in the head. Number two, rebelling against regular eating. Now, practicing regular eating sounds simple, but it's incredibly hard for many. Now, if you have a history of restrictive eating, regular eating can activate the old dieting mentality, which feels scarce and fearful. Because I think often when people diet, they kind of have to eat at strict times, they have to eat certain foods. It really feels kind of very restrictive and very rigid. So regular eating can kind of bring back some of those feelings associated with dieting, which are not so helpful. So what tends to happen then, for some people, even the mere thought of regular eating can activate the inner rebel, which almost sticks two fingers up to any kind of rules or boundaries and wants to act out by binge eating, chewing and spitting, just pushing back really. And if you're not someone who prioritizes self-care, I think very common for people with eating disorders, regular eating can also feel unnecessary and indulgent. Now, you're probably adept at feeding and looking after everyone else, but meeting your own needs does not feel familiar or right. So work to see regular eating as a scaffolding of self-care rather than a rigid plan that cages you. Regular eating can also be flexible within time windows, and it can be simple and straightforward and doesn't have to include fancy ingredients. Regular eating is an active choice towards well-being. It is not a ball and chain to leave you miserable and deprived. So think of regular eating as putting on your oxygen mask first. Because if you don't self-care by stabilising blood sugar and fueling yourself with nourishing foods, you'll be cranky and over-hungry, and you will struggle to care for others in this state. So regular eating provides a baseline for optimal well-being. So work to prioritise this and start with baby steps. So if you're just so off and far away from regular eating at the moment, literally just start with the babyest, smallest steps. These are the ones that count, okay? And you can build up to more regular eating occasions throughout the day. Okay, number 3, setting over-ambitious goals, then self-sabotaging. Now, clients have often struggled for years before they seek help. The eating disorder has become firmly entangled in their life tapestry, and it's like ivy weaving through the crevices of their psyche. Now, of course, the quick fix world demands immediate results, and humans expect the transformation and immediate gratification. It's a natural symptom of living in a Deliveroo and Amazon world. But psychological change takes time. Awareness is the first step, but will not result in immediate change. This is really normal. The subconscious runs a program which feels safe and familiar, and it's natural to repeat old patterns. So it's a normal part of the change process to lapse many times before you rise like a phoenix into freedom. So it's challenging to accept this in therapy. And armed with a strong inner critic, you may be demanding and judgmental of your perceived lack of progress. You will over-egg your goals, trying to reach the Everest peak, when base camp is a realistic starting point. And then I think if we feel we're not doing well enough, we self-sabotage. So self-sabotage can then rule the roost, as progress never feels enough. It's easy to shower disdain on your efforts, rubbishing them and thinking, what's the point? Anyway, I'm just a ridiculous human. Recovery is not possible for me, as you launch into a full-blown binge. So be patient and kind with yourself in the process of healing. Underwhelming steps are the ones to aim for, as they build momentum and are achievable, and one day you will look back and see how far you have come. Number 4, attachment to a lower weight. Now, this theme is running rife through many of my therapy sessions now, and diet culture and patriarchal influences through every generation influence a toxic normalization of extreme thinness as desirable. So it's a given for most individuals to long for a smaller body and to idealize a previous, more svelte version of themselves. And in Western culture, thinness offers acceptance and validation. It is a way to demonstrate willpower, moral superiority, and self-discipline. And people with larger bodies are stigmatized and critiqued. And deep shame runs rampant around body image in society. This is wrong, but it is embedded within the collective consciousness. So under any strong attachment to the pursuit of thinness is a feeling of unworthiness. Dig beneath the body image issues and you will find painful and distressing experiences that have understandably disrupted self-worth. And this is true for every single client I've ever worked with. Things like bullying, pervasive comments from a parent or a loved one, friendship fallouts, rejection from a romantic partner as examples. The chase of thinness offers the illusion of protection and safety from further hurts. You fantasize of becoming unreachable and armoured in your thinness to avoid additional pain. And this powerful attachment to the pursuit of thinness runs your life and screws over your eating. Because once the honeymoon of restriction runs dry, then disordered eating creeps in, as restriction is not sustainable without costs. Things like preoccupation with food, binge eating, chewing and spitting, purging, laxatives and diet pills, overactivity, feeling cold and distracted from life. Now, these things are not discussed on Skinny Talk. Instead, you see the glamorized version with six-pack abs and beautifully photographed food. It's a performative highlight reel, which is not true life. So work to offer radical acceptance towards the body you have. This doesn't mean throwing out self-care and abandoning healthy eating. It means allowing your body to be in its happy place and set point weight. This is a stable and achievable goal to sustain, rather than being in a constant fight with the body as you try to numb hunger and push on through. And number 5, weight loss drugs and surgery, not the fix. So weight loss, surgery and drugs can be valuable tools for some, but they're certainly not miracle cures. And I would not advocate these tools for anyone with an eating disorder. But I'm approached frequently by humans who have walked a brave and radical weight loss journey, shifting many pounds in relatively short time periods, which has been transformative for health and a discombobulating experience, overhaul of identity and self. So psychological support is often not a given for patients undergoing these major journeys, particularly once someone has reached their goal weight or is close to achieving this. The deeper issues underlying a difficult relationship with food then rise to the surface. Weight loss surgery or drugs cannot heal your emotional relationship with food. They cannot smooth over low self-worth or identity issues, and they do not guarantee perfect body image. In fact, chronic body dysmorphia can be an outcome for some people navigating this path. So if you resonate here, know that it's important to invest in your mental well-being as part of this journey, and it's natural to experience a rainbow of emotions and possibly a kind of existential crisis as you emerge out the other side. This is part of the journey. Be brave and embrace it with support. So, do you resonate? I'd love to hear your thoughts. You are certainly not alone. These themes come up again and again and again in the eating disorder therapy room. So if you're listening to this on the podcast, you may wish to have a written version of this as a kind of article which you can read. So do go over to my Substack. The link is in the show notes. So basically almost every podcast episode I now do is also like a written article which you can read on Substack. So this is a chance as well if you like to have different mediums to absorb content. And then I've got some other sort of different things on Substack as well. Like I have a Q&A on Friday where you can submit questions as like an additional podcast if you become a paid subscriber. And also I am releasing some journaling tools as well. So lots of good things. So do have a look on my Substack. The link is in the show notes. If you're not following me already on Instagram, do seek me out, the Eating Disorder Therapist _. And for further support with the relationship with food, do go to the eatingdisordertherapist.co.uk. And if you enjoy this podcast, I'll be so grateful if you'd follow, rate and review, as it helps it reach so many more listeners. Thank you so much for listening today, and I look forward to sharing another podcast episode with you very soon.